If I was to grade top 5 most important things to get a job in Australia right now, then they would be AMC 1, 24 months of recent clinical experience, emergency courses plus CPD activities, and a current clinical observation. Now, let me give you an example to highlight this point. Say there is a job, 50 candidates apply for that particular job. All 50 of them would have AMC Part 1 and most will also have CPD activities. Another 25 would have recent clinical experience. And if you include clinical observation, there will be only about 4 or 5 doctors. And these doctors will certainly be preferred to get the shortlisting for that job. Now, I was down for my 3rd clinical observation when I finally managed to get my first job in the UK. In the US, the IMGs do research and clinical observation to stand a good chance of getting matched into a suitable or favorable residency. And yes, there are ways to get a job without clinical observation, but that means that you are either currently employed or within a few months of finishing your job. We have recently finished the first group of our very own 4-week clinical observation program, along with the interactive learning modules plus hospital clinical orientation modules done online and in person face-to-face clinical career guidance workshop held in a local hotel. Now, in this video, I'm going to talk about what are clinical observations, the requirements of clinical observations, where you can get clinical observation here in Australia, clinical observations, does it even matter if you do them overseas, hospital versus GP clinical observation, which places are not suitable at all for doing clinical observation, and what is an expectation from a doctor during the time spent in that clinical observation. How do you describe or transfer that learning onto your CV to stand a good chance of getting shortlisted for a job? Do's and don't of clinical observation, and finally, based on all of those factors, I'll give you my conclusion. So let's get started. Now, what is a clinical observation? Clinical observations are brief periods of exposure towards a broader understanding of a role of a junior doctor in a particular health system. The duration of clinical observation, as a rule of thumb, the longer the better, or till you get the job, in my understanding. The duration, however, for most clinical observation varies between 4 to about 12 weeks. The learning aims for the period of that observation should be, number 1, to understand the local health system, like patient consultation. Number 2, to observe how doctors interact with the patient and other health staff. Number 3, to have a better understanding of spoken clinical English language. Number 4, to network with the doctors so you can get them as your local reference on your CV. What are the requirements of clinical observation? In Australia, there are certain basic requirements like, pass an AMC 1 or AMC clinical, having a vaccination proof for COVID, have a presentable CV and cover letter to apply for clinical observation positions. And most Australian government hospital or public hospital do require doctor to be a permanent resident or citizen. However, it's not mandatory. In our clinical observership, we don't differentiate between the temporary and permanent resident, and we can understand the IMGs can be at various stages of their residency status. Although the formal English test is not a requirement, you should be able to communicate well in English. Where can you get clinical observation? In Australia, and the Pilot International Clinical Readiness Program for New South Wales has just finished. And although it was a brilliant program, there are no suggestion from New South Wales Health Ministry or Health Department if it's going to be restarted over again. Also, they were only taking PR and citizens for that program, and the program or entry into that program was based on a very, technical and a robust interview, almost as if it's a job interview in itself. Here with Emergency Focus Clinical Observership Program in Sydney, we have partnered with My Health, medical practice GPs training sites in metropolitan Sydney's. Number 3, Northern Health Clinical Observation Program in Melbourne is for 6 weeks and is also for both temporary and permanent residents. Also in Victoria, Melbourne, there are other programs like Warragul, Austin, Monash IMG programs. In Tasmania, there is Launceston Clinical Observation Program. There are no official clinical program that I'm aware of in Australian Capital Territory, South Australia, Darwin and Queensland, but if I'm wrong, please drop in a comment line so that everybody can see there are actually now observership program. Now, can you do clinical observership overseas? The idea behind the clinical observation is to orientate yourself to a specific or a local Australian health system. Now, yes, if you are obtaining a comparable health system clinical observation like in New Zealand or UK or Singapore or US, fair enough. You can say and justify that I have worked or observed patient care in a similar level hospital system. Now, what is an expectation from a doctor during observation time? Basic expectations are be punctual and regular, Understand your limitation, as there are confidentially reasons you may not be allowed to have interaction with every patient. Recently, we have seen that in New South Wales international clinical readiness programs, observers were allowed to do blood tests, the cannulas, under supervision. They were also allowed to take history and do examination. And this is valid in any clinical setting as long as you're supervised and the patient are happy with that. Also participate in local teaching session, whether it's for doctors or nurses or any of the staff. Wear smart casual clothing that doctors wear in that clinical setting. For a hospital, if it's a scrub, wear a scrub. And if you're observing in a GP clinical practice, then wear casual but smart and comfortable clothes. Finally, observe everything closely and offer to help whenever you see an opportunity. Even if something as little as getting the patient from the waiting area into a consulting room, getting a patient blood and cannulation stuff if it's allowed, and getting the patient ready for the doctor's consultation and offer to write notes. It's all an experience. Be positive. This is especially important for references. You would like to leave an impression of being a team player and also a courteous person. So if there's ever an opportunity in that hospital system or in that GP practice, and they should look for your CV for you to come and work with them. When you finish your clinical observation period, what should you do? Give the GP or a consultant a thank you note or email them with a box of chocolate. Trust me, this little token of appreciation will help them remember you. Now, hospital versus GP clinical observership. Hospital clinical observership in ED, medical and surgical ward makes sense. And if you can get them, that's ideal. However, the hospitals are very busy environments with medical students, interns, RMO, registrars, other consultants. And the consultant's supervision is divided. And in this setting, many hospitals refrain from offering clinical observation position. And even if they do, the learning and supervision can be limited. Also, it might be difficult for you to obtain a reference from a busy hospital consultant due to their commitment to all the junior medical staff. GP setting are obviously the next best thing, especially if it is a busy medical practice and you are having that one-on-one interaction with your GP supervisor. Plus, they're keen to teach. It could offer more learning. Most JMOs and interns here in Australia also opt for GP placement work experience. Which places are not suitable for clinical observation? ICU, HDU, or CCU. These are critical care environments and highly specialized, and they don't offer a thorough learning of a patient journey. Mental health wards. The patient journey and interaction in mental health wards can be challenging and limited because of their complex mental and social issues. Radiology. There is a limited patient interaction in radiology department apart from obtaining a consent and doing some procedure. Anesthesia. This is also a highly specialized part of the patient care. They're primarily responsible for management of the airway, providing and delivering the anesthesia, and some aftercare in terms of patient pain management. Again, it does not provide that holistic approach to learning. Other fields like ENT, ophthalmology do not quite provide the same level of learning as other specialty do. Let's just assume you have finished your clinical observation and now you need to transfer this recent clinical experience in your CV. Number one, include this as your most recent experience with exact duration like month and year, and describe the clinical setup. Is it a busy urban or rural GP practice with large and diverse patient demographics and clinical presentation including acute and chronic healthcare issues of managing conditions like diabetes or hypertension or musculoskeletal issues or mental health issues, women health and pediatric health, and some of the preventative healthcare issues like immunization and health advocacy and some of the occupational health issues. It just already looks so well. Similarly, in a hospital setting, describe if that hospital is regional, district, tertiary, trauma, whatever it is. And which department were you observing? Was it a surgical department, an emergency department, or a medical department? Describe your role to that similar to a junior doctor, but in an observational or a shadow capacity. So that gives a reader an idea that even though you were not allowed to interact with the patient, you were actually shadowing the junior doctor in a similar role to be able to perform that role better. Number three, describe each and every step of the patient journey in your own understanding in that clinical setup. So, something as simple as taking a consent during patient history and examination, counseling and communication with the patient, counseling of the management plans, not only the clinical management plan, but the non-clinical aspect like social aspects of the patient care, which are unique to the Australian and Western health system. Also, make some relevance to interaction with other healthcare staff in a GP practice or hospital, like understanding their roles and what specific contribution they have towards the broader patient care as a patient-centered care model. Finally, make sure that you include a reference from a clinical observation. Do's and don'ts of clinical observation. Do's first. Make the most of your learning experience by being regular and always initiate and show enthusiasm. Now, I know it can be very hard to just appear excited at all the time, but find a way of actually making some comments like, this is an interesting case, this is really an interesting procedure, can I observe? Take permission during intimate patient examination history assessment. Trust me, 99% of the time everybody would say yes. So it's only your own enthusiasm and initiatives which is holding you back. Now, ask questions when given an opportunity. You'd find when you're working in a GP setting or even in a hospital setting, they are very busy sometimes, and asking a question could interrupt the thought process of your supervisor or a consultant or the team. So ask questions when they're catching up at a coffee break or a lunch break or when there's downtime. Recently, at the conclusion of our program, our doctors also saw lots of common cases with interesting presentation, and they also presented those cases during our online weekly meetings, and some of those presentations were excellent, the way that they were observed, the way they were presented. Now, network. Talk to everyone in the hospital or a GP setup, doctors, nurses, allied health staff. It helps you understand the roles that they play in patient care. Now, also maintain a journal of reflective learning, and this will ensure so much authenticity when you're applying for a job, especially filling out selection criteria like questions around the teamwork, the challenging cases and communication issues. Don'ts. Avoid using mobile phones during clinical observation. Avoid taking photos of notes or patient wounds or anything that you find interesting, even if the patient consents, because there are huge implications of breach of patient confidentiality. Now, I know it's very hard, but avoid spending time in hospital libraries and gossiping in GP practice. You are there to learn in your clinical setup. Make every minute count for you. Don't push your supervisor to do a reference. Now, I understand putting yourself out there, especially sounding enthusiastic every time, it's not for everyone. However, that's the very nature of our clinical work, to engage, to communicate, to gain trust of our patients and our colleagues. Hope you find this video useful. Please comment in the section below and tell me about your own experiences of clinical observership and let me know your thoughts. We are just about to start our second cohort of clinical observation here in Sydney. So if you are interested, please send me an email, info@emergencyfocus.net. Wishing you the very best. Take care and look after each other.